Okay, so we are going to introduce StaciJoy. She received her Associate Degree of Science in Nursing and her nursing license in 1987, continuing her education, graduating from California State University at Fullerton in 92 with a Bachelor's in Science in Nursing and Public Health. She's worked as a trauma emergency nurse in Santa Ana, California. She earned a board certification in holistic nursing at the same time. She worked for 8 years as a trauma nurse, 3 years in chronic pain management, but she decided to leave the sick care industry and enter the wellness industry, and we are going to talk about that. Stacy's main focus includes fueling athletes for optimal performance and repair, as well as families in need of improving their overall health status, decreasing their risk of developing chronic disease, and reversing the disease process. She focuses on chronic diseases like heart disease, cancer, autoimmune disorders, and conditions including the autism spectrum. You can experience StaciJoy's Health Zone, which is an internet-based radio podcast where she brings you what's what, who's who, and what's new in health and wellness today as she travels the world. I just listened to one of her shows today, and it was awesome. So we'll make sure you get all that information. She published her first book in March of 2012 called One Little Thing, How to Make Big Leaps with Tiny Steps. Here it is right here. This is a little pocket book, and it's her attempt to improve public health by addressing the sick and obese population, teaching them how to make big changes by simply adding one little thing at a time to their lifestyle habits. She happily resides in beautiful Sacramento, California with her family and their pets, and she nurtures her independent holistic nursing practice there in California. She enjoys traveling the globe, spreading the message of good health among those who are ready to learn more and make even those little changes that she recommends and they know will be good for them. So, StaciJoy, a hearty welcome to RNFM Radio.
Thank you, Keith. I am so happy to be here. It's very exciting. I appreciate the opportunity.
Tell us a little bit, just what was the first thing that prompted you just to become a nurse? Let's start right there from the very basics.
Sure. Well, that's a great place to start. Always good to start from the beginning. I, at the age of 8, was trying to decide if I wanted to become a pediatrician, a physical therapist, or something else in the healthcare field. That's kind of strange for an 8-year-old to be thinking about all that. But at that time, my mother was going through her pre-nursing prerequisites, and she brought home a cadaver cat that looked like this. It had the arms out.
Yes. Brought it home? She
brought it home with her partner to proceed to dissect this cat in the middle of our family room floor as part of their homework. So I was seeing the layers of the muscles on this cat. They called it Super Cat, and they had a cape on it that said S on it. And I fell in love with the frame of the body, and that was the time when I was 8, working with this cadaver with my mom. That's when I realized I wanted to go into the healthcare services. That was it.
Wow. You heard it here first, folks. We've never heard anything like it before.
Wait,
that is such a good story.
That is definitely the first, ever first. What an interesting story. A cadaver cat with a cape.
Yes, with a cape.
S.
And I also was kind of one of those weird, geeky kids in elementary school, and I would do the science projects on things like the kidney and body parts. So I always knew I had an affinity for the body.
What about from nursing? I mean, we heard you did trauma, you've done all this stuff, but then you decided you wanted to switch from the sickness world to the wellness world. So what prompted the switch from that world to the next?
Great question. There was a defining moment for that with me, and that defining moment was when I was about 6 years into the ER trauma. It was a level 2 high-end trauma. I started becoming disillusioned with the healthcare industry in that the same chronically sick people were coming in over and over again. There were insurance issues that I was dealing with, and it started to negatively impact me. And right about that time, I started feeling the tension. My sister was diagnosed with AIDS. She's 11 months older than I. We're very close. And that threw me into a tailspin. At that point, that was the defining moment for me. That was when I decided to become a sponge, and I got my hands on every book I could get my hands on in terms of health and wellness and prevention, and that was when I decided to veer off and start my education as a certified holistic nurse. There are several different types of people. There are the people who have the ideas that generate the ideas, and there are executors. I happen to be that person who can do both. So when I went into holistic nursing, it wasn't really born yet. I was part of the first graduating class in America, and holistic nursing was not really launched. So I had to take a concept in my head and construct it and make it work for me in an area that was completely new. Holistic nursing, a lot of people think that it's a modality. They think it's the energy work or the acupuncture or whatever, but it's not. It's a framework on how we look at human beings as a whole human being, a spirit that is formulated by thoughts and health habits. So it's all connected.
Since you made that switch, and we're talking about the healthcare system, we're talking about chronic disease, and well, we haven't got to that yet, but we're getting in that direction. I kind of know what you're going to say, but I want to hear what you say. What's your perspective on the current healthcare system? What's happening out there, kind of the bigger zeitgeist, like the 10,000-foot view? Or don't get you started.
That's a big slippery slope. Okay, so what I know is that, I've been watching the GNP of healthcare. Right now, it's right about 17.9, 18% of every dollar is 18 cents on every dollar is spent on healthcare. That is breaking our bank. The only country that is higher than us is Liberia. What I think is that we have a perfect storm going on, like George Clooney's Perfect Storm movie is coming from every angle. Mm-hmm. We have a perfect storm going on, and we have to empower every single person, every single consumer to take better control of his or her health, because nobody else is doing it. Mm-hmm. Doctors, hospitals, healthcare systems, we have to be the driver of our own bus. And that's what my mission is, my intention is to educate and inspire people to make better choices so that we can take better control of our health. If you see a cliff that drops off, the medical healthcare system is the ambulance that meets them at the bottom of the hill, broken. What we do is we create the fence on the top of it so that people don't fall down. It's more of a preventative thing. And healthcare has become way too expensive. It's fix it when it's broken, and it's the pills and surgery model. Doctors do not go to school to learn about nutrition. They don't know that that's part of the program, and they don't really know how to handle that. So we're dealing with a lot of things. They're in the sandbox with pharmaceuticals and with the food industry and the federal government, and they're all kind of playing nice together, but it's not working. So I'm trying to fix it. I
love that metaphor, Stacy, of the fence, which is disease, I guess we could say, disease and not being in a state of wellness, and we're creating the fence to keep the population from just going off the edge. I love that. Stacy, I see people like you, for instance, you're working, what I want to ask is, you're working one-on-one with people, or are you working with organizations? Can you tell us a little bit about your approach and your process as what I see as a change agent?
Sure, yes. I like to diversify different streams of income, so I do different things. Now, with my holistic public health background, I'm always interested in moving the masses, the big barge of community. And that is always in the background of with whatever I do, and everything I do is congruent. So the big thing that I promote is my public speaking, sought after internationally to go out and talk about health and wellness and nutrition. And while I'm out on the road speaking, I can feed the different parts of my business. One of them is I can pick up clients that I work with one-on-one. I can pick up organizations. Somebody saw me at one of my talks in Boise, Idaho, and she happened to work for the Idaho Healthcare Association, and they brought me in for a conference. I also have book sales that I do. But the one-on-one and business consultations are things that I really enjoy. That happens to be the only part of what I do where I trade my hours for dollars. Everything else I do is not in that paradigm. It's more residual, and it's more, book sales. It's a different kind of a sale. So that one-to-one is where I trade my hours for dollars, but it's also most rewarding as well.
I see. Well, I just want to mention to our listeners and our viewers right now that StaciJoy, you can just check her out at StaciJoy.com, and it's STACI, StaciJoy.com. That's her website. If you'd like to listen to her podcast, it's at StaciJoyHealthZone.com, and again, it's Staci is STACI, joyhealthzone.com. So if you want to check out her blog, you want to check out anything about her, read about her books, read about her speaking, and also listen to her wonderful podcasts, definitely check them out. So, Staci, you just mentioned something about entrepreneurship, and Kevin and I are both nurse entrepreneurs. We've had many on the show. Many nurse entrepreneurs listen, or would-be nurse entrepreneurs also listen and watch our show. So you mentioned something that I think probably sparked something for Kevin in terms of diversifying income, having multiple streams of income, residual. So tell us a little bit about what the things are that you do, a little bit more detail when you're not working one-on-one with a client, say with their health. What are you doing in those other aspects of your career?
Sure. Well, my latest project is the broadcasting and the podcasting, and that came to me by somebody on Facebook who found me and asked me if I wanted to have my own radio show. So I have been for the last 13 months. I've been streaming my podcast material through onetalknetwork.com, and I'm on 3 times a day, 6 a.m., 11 a.m., and 7 p.m. So that started that whole thing that I just absolutely love doing the broadcasting, because I get to do my own thing. I get to travel all over the place. And this is answering your question. I get to travel all over the world. A corporation is sponsoring me to do that. And when I'm on the road, I get to be a public speaker. So that's one thing I do. I either get paid or I don't, but I go, and I get to meet the world. The other thing that I do is I give away and sell my books, because I have a commitment to moving the masses, and I believe that this little book is the tool to reach a lot of people with.
I do have your brochure here. This is StaciJoy's Change One Little Thing brochure, and this does feature that particular aspect of your business. And I wanted to speak a little bit, Staci, about your book, One Little Thing, How to Make Big Leaps with Tiny Steps. And I've read through this. It's been on my bedside table for the last 3-4 weeks. I've read through it a couple times. My wife's been looking at it. So tell us about this book, the impact, who's reading it, who's asking for it, and who you give it to.
Yes, I would love to talk about this. I was inspired to write this book because I had been overhauling people for the past 20 years. Well, if you want to reverse your heart disease, you're going to have to give up this, and you're going to have to really, cut down on your meat and stop drinking alcohol and blah, blah, blah. And people started putting up their hands saying, I don't really want to reverse my heart disease that badly. I'm not willing to become a plant-based eater. So they were becoming frustrated with the process. So I decided to create a system that it's not new. I just figured out how to package it up real nicely. But it's the concept of adding. It's all about positive and adding, not taking anything away. Adding one thing at a time for 4 months at a time, since it takes us 4 months to regenerate ourselves completely, and it takes 4 months also to create a habit. So in the platforms of movement, attitude, and nutrition, I'm going to recommend to people that 1 or 2 or 3 things, but one at a time, 3 things in each platform that are bringing us back to the basics, because we've lost connection to the basics. What are the basics? Water, walking, attitude, the right kind of supplement. These are the things that bring us back to health, and we're just making it really simple, putting it in a little 10,000-word book, because the same people who don't want to overhaul don't want to read the big book. Guys are not going to be really picking up that book. So I was inspired to write this in a very simple, easy way, and I wrote it for 2 populations. One is for the sick and overweight population, and one is for the people who help the sick and overweight population. So what I do is I drop the price way down. They buy 30, 50, or 100 at a time, and they give them out. And that's been very, very successful for me, and it's just really spreading that word beautifully all over the country. I'm getting orders. I set them up for success by helping them to identify why they want to make a change. Why do they want to do it? What is it that they want? We have to be clear about what they want. I am not in the business of convincing anybody of anything. I just want to ask them questions. Are you happy with your health? What is it that you want to change about it? And then why? And it has to be deep, has to be emotional, has to be really, really deep. Emotional why. And then together in partnership, because I am a holistic nurse, I don't tell, I am in partnership, we decide what one little thing they're going to do for 4 months. The thing that I think makes this book pretty powerful is I give a tool at the end of the book called the JOLT, the just one little thing to go back to. It's a 3-step process to get them back on track, because I know that the things that are the easiest to do in life are also the easiest things not to do. So they'll jump on board and then they'll fall off track, and I give them a whole chapter on how to get back on track. And change is just a series of jumping off the wagon, getting back on, jumping off and getting back on over and over again. So that is how it works. And I can hold them accountable, or I can just give them the book and say, here you go, follow it, follow the system.
Right. Read the JOLT. Here's the chapter right here.
Right. Well, and a lot of people from a compliance standpoint, they always feel like it's punitive if they kind of derail a little bit or kind of get off course. So
Yes.
that punitive approach is definitely not, sustainable at all. People just put their hands up and say, enough, I'm done.
Right, and that's sometimes you run the risks in a therapeutic relationship if you're holding them accountable. But what I address in the book is I address that punitive process that we all do in our minds when we fall off track. And I call that going to the dark side. Oh, I'm such a loser. Why did I even start this? I can never finish what I start. Well, that's a whole process that goes on inside one's head. It's okay. I let them be there. I actually encourage them to go there, but eventually they need a defining moment to get back on track.
So, Stacy, there's so much to talk about with you. There's so many things you're passionate about. You're passionate about health. You're passionate about individuals. You're passionate about the bigger picture of the healthcare, just the whole healthcare ship right now, the zeitgeist. So, tell us, is there anything new in your life right now that you're really zeroing in on? Is there some new thing that's really catching your eye or catching your ear at this point in time?
Well, right now, Keith, I am putting some effort into just getting the podcasts and the broadcasts out, and I am always trying to come up with creative, fun content. The editing process is time-consuming, but it's a lot of fun to get the content together. Like right now, I'm working on a show about the psychology behind eating, and I've interviewed several people for that show, and I string it all together. So I love doing that because I know that it addresses the healthcare situation that we're in by doing the content that I do. It also moves the masses, and it's entertainment. It doesn't get much better than that. The other thing that I'm doing is I'm expanding my Juice Plus franchise and getting a more involved in bringing people on to work with me to expand that franchise. So that's a big deal to me at this point as well. And fueling athletes. I love to fuel athletes. I work with a couple of gyms and do their nutrition counseling as well.
I just want to repeat your websites, StaciJoy.com. Again, Stacy is S-T-A-C-I, StaciJoy.com. If you want to see Stacy's book, you just go to the website, just click on book, or to go to StaciJoy.com/book. You can read about one little thing, movement, attitude, nutrition, make big leaps with tiny steps. Order a whole bunch for your friends, for your colleagues. Also, if you want to hear Stacy Joy's podcast, her wonderful podcast, it's StaciJoyHealthZone.com. Now, where else can they find you, Stacy? Where can they connect with you, chat with you, or hear about what you're doing?
They can find me on Facebook under Stacy Joy. and they can listen to me broadcast every week, 3 times a day on onetalknetwork.com, or they can call me 800-384-0574. I love to hear from nurses. I just give it away. Call me if you want any help making that leap into entrepreneurship or empowerment. Give me a call. I'd love to hear from you.
That's great. That's great. So, Kevin, any other questions for Stacy? We have a couple minutes left, right?
No, well, like I said, I felt like I've really connected with another like-minded entrepreneur out there. Love to hear that you've also got, as I call it in my household, running businesses and having 3 kiddos. It's called Controlled Chaos. I actually have a personal vlog out there on YouTube that it's titled. Part of my YouTube channel is Controlled Chaos, to really kind of hold it all together, because that's really what it is when you talk about all the balls in the air and juggling this and shifting this and trying to make it work. But we make it work, and I love that as an entrepreneur I have choice to be able to make it work.
Mm-hmm.
That's right, and also to be organized enough to know what you want. Like, what is your gig? What is your purpose? Why are you here? What is it? For me, it's moving the masses in a better health direction, one person at a time. So being clear on what you want is, I think, really, really important. The last thing I want to get in before we take off, so in case I forget, I would like to thank Melody Vall. She's an RN, and she is the one who asked me if I'd ever heard of RNFM Radio, and she got me in touch with you guys, and that's been a really great connection. So thank you, Melody.
Wow, thank you, Melody.
Yes,
Thanks a lot.
Thank you. Yeah, we love these referrals. We get messages. I think you came through our Facebook page, if I'm not mistaken, Stacy, and you and I connected and then had a chat. So whatever channel it was, thank you so much for taking her up on that suggestion.
Yes, I know a good thing when I see it.
Oh, thank you.
Well, we do too, Stacy. That's why you're here. And what a pleasure, what a blessing to have you here. Again, I love all of these folks that we just get to meet on RNFM. Keith, we're the luckiest guys out here.
We are.
I'll tell you what.
That's true. That's true.
Nice gratitude. Thank you, Keith and Kevin. You've been a pleasure to talk to, and I look forward to a long relationship.
Thanks, Stacy. We'll have you back
as well. Thanks, Stacy. Have a great one.
Thank you.
Bye.
Bye.
Bye-bye.